And in Deena's Health Works, a kinder, more gentler tonsillectomy. Those stories coming up next.
Tonsillectomies, they're usually performed on kids, but don't be deceived. It's a common operation, but the recovery can be very painful. Tonight in HealthWorks, Fox 2 Health reporter Deena Centofanti shows us one local doctor who's using a new tool to ease the pain.
You hate to think of your child going through all the pain that's often associated with a tonsillectomy, but a brand new procedure promises to let patients eat the same day, and usually there's no pain medication even required.
Well, Mom, can you hold your hand?
Who wouldn't need Mom minutes before a tonsillectomy? Although 6-year-old Lauren is one of the first to have her tonsils taken out with a new type of knife that vibrates.
It's supposed to be a lot quicker recovery and, a little less painful for the children.
The new tool is called a Harmonic Scalpel, and Dr. Kitain in Commerce Township is one of the few to have one. Let me explain exactly what makes it so different. Usually in a tonsillectomy, the tissue is burned away at temperatures that go up to 450 degrees. Here's a graphic picture of the new tool at work. You see it cutting the tissue surrounding the tonsil with that small blade. It's vibrating over 50,000 times a second.
Which provides very little heat, between 50 and 100 degrees, and therefore very little tissue damage, which results in quite a bit less pain.
Open real big and wide.
In the end, the patients seem to be doing okay, and the doctor believes the healing process is much easier.
Subsequently, the patient will be able to eat and to swallow much sooner, so the chance of becoming dehydrated is much less.
How do you know if your child needs a tonsillectomy? Doctors say the big indicators are frequent throat infections and if a child has trouble breathing because of large tonsils. That's HealthWorks. I'm Deena Centofanti. Back to you.
Ultrasounds is something you normally associate with pregnancy.
Yeah, but tonight doctors are using a similar technology to remove tonsils. Coming up in Good Health, a brand new surgery with much quicker recovery time and much less pain.
A local doctor is performing a breakthrough tonsil procedure.
He is the first in our state to do it, and Lila Lazarus is back to tell us about the benefits. Lila?
Well, Ruth, Emery, maybe you remember getting your tonsils removed is one of the most common procedures children have, but it's also one of the most painful. Well, now a brand new technique is minimizing that pain, making tonsil removal more tolerable and a little less scary.
5-year-old Erin Oleskowicz and her 6-year-old sister Lauren are happy to show off their mouths. A little over a week ago, they were in so much pain they could barely speak.
They would have sore throats. They'd have a hard time eating solid foods. Their ears would hurt. They'd be ringing, or they'd have a tough time with, hearing, things like that.
The girls had tonsillitis, an infection that causes your tonsils to swell, making it hard to breathe. But the procedure to fix the problem is usually just as painful as the problem itself.
Traditionally, tonsil removal can be painful and sometimes very painful. Patients may not even want to eat and drink for several days.
So Marty sought the help of a doctor, Dr. Donald Kitain. He's performing a new procedure that eases a patient's discomfort.
They can start eating and drinking much sooner. There's less of a chance of becoming dehydrated. There's less of a chance of bleeding postoperatively. And they also feel quite a bit better.
The procedure uses a harmonic scalpel. It's a mechanical device that uses ultrasonic energy to cut through tissue, not electrical heat like traditional tonsillectomies. That means less tissue damage.
So therefore you get a lot less pain, and the healing process is a lot faster.
Within 24 hours, Lauren and Erin felt better. And the quick recovery impressed Marty, who couldn't bear to watch his girls in pain anymore.
No one wants to see anyone go through pain, especially with children.
For sure. The harmonic scalpel procedure is covered by most insurance companies. It doesn't completely eliminate pain. Some patients may still feel pain up to 36 hours later. For more information on the procedure, contact Huron Valley Sinai Hospital.